Hi, Teresa Noot here today again, and we're going to cover hypertension. Just want to give you a brief overview of it. This is certainly not meant to be in-depth, but it should give you a lot of the basics of the condition as well as resources for research, not only on the integrative level, but on the traditional, conventional medicine as well. So hypertension is really a reflection of blood circulation, and your blood circulates throughout your body, and the heart is really the pump for that. So for those of you who are medical, okay, some of this is going to be super elementary, but just remember that not everyone in your class has medical background, so please just bear with us. But so the heart is acting as a pump, and some of the vessels, which are called arteries, are going to have the fresh oxygenated blood in them, and some of the vessels, the veins, their sole job is to carry blood that no longer has enough oxygen from the body back to the heart so it can be reoxygenated. So this is the whole working of that pump that circulates blood throughout the body. And blood pressure, which is one of the measurement for hypertension, is really the amount of force that your blood puts on your artery wall and moves through your body. And there are ranges of blood pressure. And the standard at this point, which blood pressure is something that changes every few years, so always be tuning into the most recent values because they do tend to change a little bit. It used to be, and I've been a nurse too long to admit, but it used to be that 140/90 was considered a normal blood pressure, and as you can see, we've really changed that over the years. So blood pressure is something that changes slightly over time, so just make sure you're tuning in to the most recent values. But blood pressure increases and decreases throughout the day for a variety of reasons. So know that your blood pressure is not the same from minute to minute and hour to hour. And we use staging to classify it. So it's normal blood pressure, pre-hypertension, high blood pressure stage 1, and high blood pressure stage 2. And you know, normal is 120/80 right now, or less than 120/80, and between 120/80 and 139/89 is considered this borderline state where we need to start monitoring for signs of hypertension. And then you can see that the other ones are a progression of hypertension or high blood pressure. And there are several medical and integrative interventions that can help to reduce blood pressure, and we'll talk through some of that, as well as, you know, as I said, the measurement, or if a person has hypertension, the thing they will be doing to monitor will be checking their blood pressure. So we just wanted to give you a quick overview of how blood pressure is measured. In case you don't know, I'm hoping all of you have been to your doctor's office, so you've had it done, but you may not have exactly known what they were doing. So obviously we put on the inflatable cuff above the elbow, and it's inflated until there is no sound left. And then you deflate the cuff. And when you hear a sound, the artery is opening and closing with the contraction, that's the systolic reading, or what we call systole. And then at a certain point there's no sound left because the artery is open, and that's diastole, or the diastolic reading. So we're listening for when the heart starts making a noise and when the heart stops making a noise. And when the heart starts making a noise, that's the systolic, and when it stops, that's the diastolic. So the reading is recorded as the systolic number over the diastolic. So that gives you some of the background of how that's all done. There are several risk factors for hypertension, and as you'll probably see, people usually don't just have hypertension. It's often part of comorbidity. And obviously diet is huge, so a diet high in salt, fat, or cholesterol puts you at increased risk for hypertension. But chronic conditions put you at risk for hypertension: kidney disease, diabetes, hormone changes, hyperlipidemia. Family history, there's a very big genetic component. Inactivity, so our couch potatoes are at risk. Aging, being overweight, and ethnically, people of non-Hispanic, black race are the most at risk. Some birth control medication can put people at risk for hypertension. Stress, obviously, tobacco use, and excessive alcohol. When we talk about risk factors for hypertension, there are those that are changeable and those that are unchangeable. And obviously, as a coach, you would help them focus on the changeable risk factors, because things like aging, race, family history, gender, and being pregnant, there's not a lot you can do to change that. However, helping them with weight loss and dietary changes and decreasing their use of alcohol and getting more active and smoking and stress are things the coach absolutely can help with. Hypertension is challenging in that there are often no symptoms, which is why really for anyone you coach with any condition, routine medical care, including getting regular assessment of blood pressure and other vital signs, is just really critical. Severely high blood pressure may include the following symptoms, and I would say the caveat is, but not always. But if your person has any of these symptoms, and even if you're working through an emergency plan for them, these are the things that require immediate medical care. Headaches that persist, nausea, vomiting, confusion, changes in vision, nosebleeds, blood in the urine. So you can see how some of this can feel like the flu that just doesn't get better. It can be very non-distinct, so not everyone has these symptoms, but these are some indicators that something is not right, and they need to go to emergency room right away. Because hypertension can be very dangerous. If it's not treated, it can lead to stroke. It can lead to thickening of the arteries or arterial sclerosis. It can lead to kidney failure, aneurysms, coronary artery disease, heart attack or heart failure, and dementia or cognitive impairment. So very, very serious side effects of unchecked hypertension. There's a lot a person can do to manage hypertension because it is a very stress-related condition. And obviously, like I said, you want to be seeing your healthcare provider and monitoring blood pressures. Quitting smoking is a huge help to blood pressure, as well as dietary changes, and the DASH diet happens to be particularly useful for the management of hypertension. Getting movement every day will help with the blood pressure readings. Losing weight. Relaxation techniques are huge, so yoga, meditation, tai chi, biofeedback, anything else, mindfulness, all of it's super helpful. And then if there are medications, making sure to take them. If a person were to stop a medication without forethought, it can be you can have a hypertensive crisis or your blood pressure can skyrocket. So you want to make sure people are staying on their medication. It's really important. And we want to bring to you Dr. Andrew Weil as a resource for integrative approaches to hypertension, because he looks at things, as you can see, like dietary intake, supplements, and just different ways of doing things that might impact the experience of hypertension. So I'll give you just a second to read through that. And this this presentation is available in the resources, but we'll just play it here now because I think it's a great quick story of the client's experience of having and managing hypertension. So please hold while we load this video to hear more information. Just kidding. Okay. Here we go.
My name is Kendra, and I have high blood pressure, and I was diagnosed in 2006. Prior to my diagnosis, I was a single mom. I never exercised. I had headaches all day, every day, especially in the morning or when I went to bed at night. I always felt fatigued. We were sponsoring an event, the company that I worked for, and we went to the event. It was a heart healthy fair. I had my blood pressure checked, and the person who I had the blood pressure check with, she asked me, was I feeling okay? My blood pressure was maybe, the normal was like 120 over 80. Mine was like 150 over, I don't know, 96. It was really, 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 really high. So after the health fair, I made an appointment to see the doctor. She asked me if anybody in my family had high blood pressure, and I was telling her that my dad had high blood pressure, also diabetes. So then she set me up for a stress test. You had to run like a mile and a half, and I don't think I only got to, I don't know, a mile, and I almost fell out. I failed the stress test. My doctor told me that you need to lose some weight, and you definitely have high blood pressure. So I asked her what I could do, and she said, you need to change the way you eat. Just change your lifestyle and the way you eat. I was in denial. I was really, really in denial. I mean, I just decided to make changes, not so much for myself, but for my daughter. I wanted to be around. I lived a very active life, and Kayla is very much a part of my life. And we do everything together, and I didn't want it to be a situation where something would happen to me, something that I could control would happen to me to where I would leave her by herself. So I just decided to make the change. I lost 57 pounds, and I've kept it off. And I lost the weight by changing my diet, my food intake and my drink intake of soda. And then I also incorporated water, and then I exercised. I did kickboxing. I started doing Pilates. The people in my life are very supportive. My girlfriend and I, Nikki, and my daughter, we live here, and we all live healthy lives. It's a team effort. Kayla was great. She was always energetic and helping me do things. Nikki was great as well. She made sure that I stayed on task. She is the chief preparer of food in the household, so she makes sure that we always are eating the stuff that we're supposed to have. Start eating more healthier things. We incorporated a lot of chicken, a lot of grilled and baked chicken, a lot of fresh vegetables, and we exercise together. It's just, again, a team effort. Living with high blood pressure is definitely different. It's a lifestyle change that you have to adapt to. Anyone who's diagnosed, there is a turnaround. You just have to make the change and know and be consistent and stick with the change. I just want to be able to live a happy, active life. I want to continue to keep the weight off. I want to make sure that I'm just heart healthy. I mean, it's huge for me. And I just want to be around. She definitely is the person that I say, okay, well, I got to be around. Because I feel, and any parent would feel, that she's destined to do great things, and I want to be around to see those great things that she does.
So we also want to cover common concerns of a person with hypertension, and you probably heard some of them from the gal in the video, but really the quality of life is huge. You know, I want to be around is what she said. And for men, one of the big side effects of hypertension is impotence, so you can imagine how that is for them. Dietary changes can be challenging. The impact of symptoms, like she said she had headaches all the time. Variations in blood pressure readings. People can become very hypervigilant about their blood pressure, and it is good to remind them that blood pressures will vacillate a little bit. They will change during the day, but obviously you want to be mindful of having consistent readings that are not what they should be. Medication side effects. There are side effects from the medication. Managing stress and fear of having a stroke. These are the big common concerns. So some coaching questions that might help is, what's working well with your current management? And we're going to bring these in early and say to you that they're going to work for any condition. So we won't repeat them every single PowerPoint, but it's kind of like, what is working well with your current management? What is not working well? How are you feeling about managing your condition? If you were to change one thing about how you manage your condition, what would it be? And in what ways is your condition affecting your life? So these are just some possible coaching questions that you can use for multiple conditions, obviously. So there are a number of resources. Again, you will have access to all of them through through both the Moodle site and the the document with all the resources, so that you can start to build your library.